The National Water Supply and Sanitation Council, NWASCO, has been mandated by the Water Supply and Sanitation Act No. 28 of 1997 to regulate the provision of water supply and sanitation services in Zambia.
In 2018, we said, look, we needed to look at the mandate as defined in the Water Supply and Sanitation Act, and as a first call, we had to develop the frameworks to use in order for us to regulate water supply and sanitation. But also utilities had to refocus and look at the whole sanitation value chain. You might be aware, as I've already indicated, that following the formation of these utilities as water and storage companies, we had to ensure the name changed so that it can reflect the mandate as defined in the Water Supply and Sanitation Act.
With the introduction of on-site sanitation and fecal sludge management, service delivery and responsibilities, there was a need to develop key performance indicators to monitor, evaluate and regulate service delivery and attainment of national and global targets.
And what is important to know is that these frameworks were developed to provide a proper framework in terms of how services need to be provided and be regulated.
NWASCO, through a consultative process with multiple stakeholders, developed city-wide inclusive sanitation guidelines in 2022 that have guided commercial utilities on planning and service provision of on-site sanitation and fecal sludge management.
We have developed a city-wide inclusive sanitation service provision guidelines. We also developed guidelines that are related to minimum service levels. So working with Zambia Bureau of Standards and other stakeholders.
Currently, we are working with NWASCO to develop standards. This standard will have 4 parts. The first part will be interface and containment. Second part will be emptying and transportation. Third part will be treatment. And the last part will cover aspects of reuse.
We've been able to support NWASCO in areas of creating what are called CIWIS cities, citywide inclusive sanitation cities, which are supported with joint implementation teams spearheaded by NWASCO in trying to get stakeholders together to try and ensure that issues of sanitation are dealt with at the city level. Also to support NWASCO in aspects of data. Data is important for regulation. You cannot regulate without data. So we have supported NWASCO to implement a GIS system integrated together with an information management system, IMS. And this is also being done not only at the regulatory level, but also at the national level. Also, the other aspect that we have supported NWASCO with is to try and strengthen the financing mechanism for the sector. The regulator needs to have some oversight in terms of what is happening with the investments that are going into the sector. So a particular tool was developed to try and support this process, that utilities are able to somehow assess what is being done with the investments that are going into the sector in terms of changing issues of coverage, safely managed and equity.
These guidelines bring immense benefit of spelling out the regulations across the entire sanitation chain, from toilet types to sludge emptying services, to treatment and to reuse, effectively providing service providers with a clear framework and the enforcement and guidance that effectively allows them to advance safely managed sanitation and achievement of SDG 6 and Zambia's Vision 2030.
Commercial utilities have extended their mandate to a third-party service provider by way of signing contracts with them to carry out on-site sanitation and fecal sludge management services in compliance with NWASCO license conditions.
Kanyama Water Trust has a delegated authority from Lusaka Water Supply and Sanitation Company that gives us the mandate to provide these services in Kanyama 13 and 14.
So we have 2 types of technologies, the labor intensive and the technological neutral. So we have since given the permit to 10 service providers who are working under the labor intensive, meaning these are emptying pit latrines from peri-urban areas and we are yet to introduce the other permit for the VOT. These people are getting the septage from the septic tanks.
Considering NWASCO's achievements thus far, the journey continues to achieve its Vision 2030.
When you look at where we are coming from and where we are going, we think if we limited ourselves to sewerage, we won't be doing justice to the issue of public health and hence the extension of that mandate.